All right, good evening. Welcome to tonight's segment of the Faculty Lecture Series. I'm Jessica Lardy, Professor and Director, and I run the lecture series. So thanks for attending tonight. Keep an eye out for upcoming lectures. I have rack cards over there behind Dr. Webb. Grab one on your way out. Next lecture is next Thursday, November 6th, featuring Professor Mary Wilhelm of Art. So this evening's event is presented by, for the first time announcing this, Dr. A.J. Webb of Healthcare Administration from the School of Business. Dr. Webb was born in Mesa, Arizona, and in his words, raised in the dirt, sticks, and grite of Apache Junction, Arizona. He came to Adams State on a football scholarship, earning multiple RMAC academic awards, and was recognized by the National Football Foundation for excellence in intercollegiate football and academics. Dr. Webb graduated from Adams State with a Bachelor of Science in Business Administration with an emphasis in healthcare, and thus started his 10-plus year career in the healthcare industry, during which he completed a Master of Business Administration in Leadership, also from Adams State. He recently completed a doctoral degree at A.T. Still University's Health Sciences program in the Organizational Behavior and Leadership program. Dr. Webb has taught at the college level since 2016, with 2025 marking 9 years here at the institution. Dr. Webb is fascinated with the relationship between groups of people working towards a common purpose and the effects on their health. So tonight's lecture is titled Assessing an Institute of Higher Education Employee Population's Health to Inform Worksite Health Promotion Program Strategic Planning. And in his words, institutions of higher education are facing pressures that negatively affect employee health and are adopting practices like workplace health promotion programs, or WHPP. Experts in WHPP recommend systematic approaches, evidence-based interventions, and rigorous evaluation. Identifying an institution's employees' population's health risk factors and WHPP preference are key for strategic expansion of protective factors and decreasing risk factors. So help me in welcoming Dr. Webb.
Everybody, thank you for coming. I realize that you walked. Hello. Thank you for coming. You walked past candy to come here. You got some piece, so almost walked past candy. So thank you for your time. And boy, that's a mouthful of a title, right? And there'll be pieces of that I'll unpack through the presentation. This presentation is virtually the same. It's a little bit longer than the presentation I had to give to my peers and faculty members at A.T. Still University as part of the grand finale of wrapping up my final 10 weeks of scholarly deliverables, which included making a poster, making a presentation, and wrapping up my manuscript. Right, and it was quite the journey. It's quite the journey. It's been a 5-year journey, I don't know if suffer is the right word. I definitely may be afflicted by what I describe as a terminal inferiority complex, which means that I don't have a real high opinion of the things that I do and the things that I say and the things that I accomplish. But I'm proud of this. And it reminds me a little bit of a project I did during COVID. I don't know if everyone else was stir crazy at the time or if it was just me and my family, but to help keep sanity, my son, my daughter, and my wife and I, we started a little project. out in the yard. And that project was a playhouse. Okay? Now, the playhouse was something for us to do during COVID, but at that time we were kind of recognizing that our, 2 kids were getting bigger, and our 1,100 square foot, very modest home was feeling a little bit cramped. And being at home, we start doing wild stuff like looking for other places to live and thinking about moving, despite how much we love where we live just a couple miles east of town. And so rather than move away, we decided that maybe putting an addition on our home will be the way to go about it. We like the location. Let's just make it a little bit bigger. And I thought I was going to be doing some of that addition, and I did. I just didn't do the main parts of it as far as the foundation and the framing and things like that. But that's not where my head was. I thought I was going to be a little bit more involved in it during May-ish of the COVID year, and so I built a playhouse, and that playhouse is sturdy, right? And I use that playhouse to learn about construction techniques, the whole process from setting a foundation, framing, flooring, cutting rafters and birds' mouths, and just in case I was going to need those skills to work on their addition, right? And so I would liken this project a little bit to that playhouse. It's sturdy. It's not exactly habitable. You could, if that's what you needed to do, but I learned a lot going through the process. And having the doctor part in front of my name, this is not the end. This is not my magnum opus, but it is what I like to think is the beginning of being a researcher that's taken a look at groups of people that have a common goal, whether that's sport or to educate young persons that enter the hallways of Adams State, and how the pressures and the environment of the workplace affects their overall health, right? So that's the part that I'm really interested in. It mixed 2 things that I was interested in, which is health and business, which is what I'm a faculty member of. So we got a mouthful of a title here, and so this is the place, right? We're talking about Adams State. I was very fortunate when I was picking out my project topic. I was very much leaning into, at that time, college athlete, student health, probably something along the lines of mental health or health literacy or healthcare access, considering maybe doing a needs assessment for our sports medicine program here at Adams State. And the reason I was thinking about those things is because I didn't know if I was going to get a shot at the thing that I was really interested in, which is wellness programs or workplace health promotion programs. I spent some time as a professional, as a wellness coordinator over at our local hospital and at the behavioral health, coordinating pro-health type activities. And when old Dr. Tanberg said, "Hey, we'd like to get a wellness program going around here. I understand you have some experience. Thank you for the recommendation, Coughlin." He included me, and he said, "Webster, whatever it is you're up to, feel free to use that data and do a twofer, which is serve Adams State and scratch my own itches as far as doing a little bit of research." Okay? So that's the place. A worksite health promotion, you'll often hear these referred to as wellness programs. There's a few other names, corporate wellness programs, but basically is, look at your group of people, what are some of the things that they need that could support their health, but also like how's their health doing, right? Because I've had a lot of conversations with folks, typically at the C-suite level. They say, "Hey, we'd like to start ourselves a wellness program here at this place or this place at this place," and their motivations vary depending on who it is you're talking to. Some of them are interested in managing costs of healthcare. Some of them are interested in increasing productivity, and some folks think it's the right thing to do, which was Dr. Tanberg's stance, and that was a little refreshing. One, to have a key leader on board with employee health and wellness here at Adams State, but 2, his view of it was people spend 8 hours or more a day at work, right? They spend more time at work than they do with their families, and this environment impacts their mental, physical, and emotional health. So that's how I got started. That's how I got included on it. And the places where I had engaged in workplace health promotion programming, it varied as far as actually having any type of goal or outcome or a strategy. So that's where I wanted to, use my old noggin here to start figuring out, like, well, what can workplace health promotion programs do? What do they do? What should they do? And then how do you know what you should do around our particular campus, right? So the ultimate goal is to take what I've done here and start working it into a legitimate strategic plan. Fortunate to be mentored by Professor Grillardi over here that is going to probably have a pesky AJ knocking at his door a little bit, talking a little bit about developing a strategic plan around something that's pretty abstract and very challenging in a lot of ways to build a strategic plan around. Okay, so it's a little mix. Like, why did I choose this particular topic? Well, I have these personal experiences of being a professional, working at 2 different health service organizations here in the San Luis Valley. As the recruiter, I was using workplace health promotion programs. It was like a funny thing, like a funsy thing for me to participate in. My Uncle Mike likes to make a joke. He talks about how, my Uncle Mike, I love my Uncle Mike, he's very proud of me, but he makes this joke. He says, yeah, and then the boy got an internship over at the San Luis Valley Behavioral Health Group. They must have needed a cleanup hitter on the company softball team. And that's a fun joke. I like that. But he's not, that's not why I got hired there. I got to work on some different grants and things like that were meaningful and had some work to be done on them. But one of the first funny things I got to do was they said, hey, it seems like you like to work out. You want to be a part of our wellness committee? And I said yes. And not a ton of strategy other than let's put some bananas in the break room. Hello, Tanbergs. Let's put some bananas in the break room. And that organization was engaged in what I would describe as RAWs. Okay, that's RAWs as RAWs, random acts of wellness, where they're nice things, but they're not exactly oriented at a particular outcome. They're nice things to do. Employees appreciate them, but you have no idea whether or not you made a difference in anything. And, well, we're smart people around here, and I think we can do a little bit better than that. So I had the professional experience, my own personal experience. A lot of it has to do with being a student athlete, right? There were things to support my physical health, my academic health, as a member of a sports team, and that involves the mentorship of the coaches that I had, someone checking up, making sure that you're eligible because they have a vested interest in you being able to play on Friday, Saturday, Sunday, whatever day it is. But I also had access to athletic trainers, was encouraged to exercise, was encouraged to eat well. And so those personal experiences, have resonated and stuck with me over time. And when I think about, this employee population here at Adams State, what is it that we can do to also support the, endeavors that each individual is on and, their contributions to the organization. And anytime there's an opportunity to serve our fine institution, I like that idea. Really enjoy this place, really enjoy being a part of it, and being able to take some of that personal and professional experience and apply it here alongside of scratching my research itch and generating these scholarly deliverables required by my program. It was very much a perfect synergy. So, Dr. Tanberg, thank you for inviting me to do wellness program stuff at Adams State, and thank you for your support, Darren. All right. So, I had to give this slide to give everybody a little bit of context when I was talking to my peers and my faculty members, talking about Adams State University as a small liberal arts university in rural Colorado. And in the scheme of wellness stuff, that presents some challenges, but there's also some really nice parts about being in a rural area, in particular in southern Colorado, because we got a lot of sunshine, and for the most part, we get quite a bit of nice weather, so that gives us a lot of opportunities to engage in some outdoor recreation, of which we have some of the finest opportunities as far as hiking, fishing, hunting, if that's your thing. And talked a little bit about the students that we serve. Part of this project that tickles my fancy, so to speak, is the idea of Adams State University employees modeling healthy behavior, utilization of health resources to a group of folks that may not have seen those things in their home. I think that there are, a good chunk of students that are a lot like myself, coming from a household where mom was the only income earner, where we were blessed to have everything that we had, but there wasn't a whole lot of, it was kind of hard to make the ends meet. So, we had health insurance, we just couldn't afford to use it, right? So that doesn't, I did a bunch of stuff as a young person that I probably should have gone to the doctor for, like getting poked in the eye, playing around in the oleanders. And if you're familiar with Arizona, oleanders are big tree, bushy type things. They kind of use them as, landscaping fences, and they're poisonous, right? And I thought I was going to get in trouble if I went and told my parents that I had been poked by there, because they basically had told me, don't play in there because you're going to get poked in the eye. It's going to be a real deal. But the idea of having my mom have to take me to the doctor is going to bankrupt us. Like, it's going to be a real issue. So anyway, I think modeling some of the, utilization of healthcare services and building health literacy is an opportunity that we have here on campus with our students, right? So per the president's request, he said, hey, we'd like to get some people moving. We'd like to get some people spending some time together in a context that's not just the workplace, right? And the charge, right? And David, since you're here, you can, check me on some of these, but because I fill in some of these, gaps a little bit, right? Our initial discussion, but design, implement, and evaluate a workplace health promotion program here at Adams State. And I'll use this WHPP throughout the presentation, and I may say wellness program every once in a while, right? So what should we do? Let's do it, and then let's see if it made a difference, right? So we got this tidy little graphic from our work that we did, what would have been 2 summers ago, as we sat down and we said, hey, what do we want to do with this thing? We gathered a variety of different stakeholders to be a part of this, including the VP of Student Affairs. So that's a person who gets access to the C-suite on a regular basis, can kind of keep us in the know, help us advocate for resources. We included Caitlin Smith, who's a part of athletics, and that's a tremendous set of facilities to have access to when it comes to getting people physically active. Keeping someone in there from HR in particular. I don't know if her title is benefit specialist. I know that's what she does. But anyway, so she's largely responsible for open enrollment and getting us involved in the using the different benefits that are provided to us here at Adams State. Dr. Raina Kirkland, who is a wellness advocate her own self. She and I are chairs of this dealio. So gathered a variety of different stakeholders to come together and start this conversation about what could this thing look like, okay? Now, a workplace health promotion per the experts in the field, and I got a little side story about some of the experts because I didn't know I was in a room and having conversations with someone who was like a pretty big deal in that particular space back in 2019 when I was at a conference, all right? So workplace health promotion is a coordinated, systematic, and comprehensive approach to increasing employee health or improving employee health and decreasing risk factors. And those particular terminology is something that I focus on, right? Can we increase protective factors? Can we decrease risk factors? When I was working in substance use prevention, that was mostly the gig, right? Can we give students, so my age group that I was working with at that time, ages 13 to 18, can we provide them pro-social, substance-free opportunities like after prom, right? So prom, it's a special time of year, but the post-prom activities, they can get a little bit on the risky side for young people. So rather than letting them off after they get released from the dance to do whatever it is they want to do. You invite them to the Alamosa Family Rec Center, and you give away fridges and DVDs, as DVDs at the time, and you have a magic show, and you give them something else to do that doesn't involve alcohol, tobacco, and other drugs, right? So that's an example of increasing a protective factor, and then, there's a variety of different risk factors you can work on, right? Now, workplace health promotion programs are building a momentum is the right way to describe it, but they're increasing in prevalence, right? There's a project from the Department of Health and Human Services called the Healthy People Survey, and it's more like the Healthy People Project, and they do one every 10 years where they set some goals, right? And in the case of workplace health promotion programs, the goals for 2030 are to increase the proportion of employers that offer a workplace health promotion program, but they haven't quite dialed in all the metrics because this is kind of a tricky thing to do, right? So they want more of them, and that was encouraging when it comes to saying, like, hey, is this even a thing that we should be engaged in, okay? Yep, that's where that stuff comes from, okay? Now, I had a little big wordy slide, right, but decided to use some pictures instead, right? So, institutes of higher education. One of the big pressures we face is declining enrollment, right? And so as resources, and we'll play graph now, as enrollment has declined, right? My understanding is you're kind of asked to do more with less, right? Does that sound right, David? Yep. Okay. And that creates some pressures, right, and increases some job demands. And some of the folks that have looked at workplace health programs in universities, they talk about this jobs, resources, and demands model, where they basically say that institutes of higher educations, the demands on the employee in a lot of ways have outpaced the resources available. And this is an important thing for me to kind of learn and think about, because my initial interest in my program, I was looking at burnout in healthcare workers, right? And that was my boogeyman to go after working as a wellness coordinator at SLV Health, right? It's definitely like a hot topic and a bit of a buzzword, and I believe that it would have been like the biggest issue that we would have been working on in healthcare had it not been for the pandemic, right? The National Academies of Science, Medicine, Engineering released a big paper in 2019, which all focused on addressing burnout in healthcare clinicians, because burnout's an issue in a healthcare facility. It's probably a contributing factor to the increased rates of self-harm and suicide in healthcare professionals. So it's not good for them. It's got physical health consequences for them. It's got mental health consequences for healthcare workers. And that's bad enough, but burnout folks in healthcare typically have patients with worse health outcomes, right? And so that's when I initially kind of got into the, this like headspace of like, okay, workplace health promotion programs potentially as a remedy for some of these things. And it was a paper that I read that likened or paralleled the institutes of higher education with healthcare, and that kind of not this super solid connection, but the two ideas, right? Because the demands on the healthcare industry in the United States, those have increased. They're being asked to do more with less. They, are getting compensated a little bit different, but for the most part, there's a lot of similarities between the two service industries, where I'd say that the healthcare main product that they offer is compassion, right? Like being with people, taking care of them, and that's what those folks are really driven by, is helping people, right? And in a lot of ways here in an institute of higher education, we're driven to help folks too, right? It's just a little bit different, right? We're preparing them to be good citizens and critical thinkers, and preparing them to go and contribute in whatever capacity. So that was an important thing for me to check out. So there's a lot of different things that institutes of higher education have been doing to tackle some of these pressures. A lot of them end up being student-facing, but it seems that they're coming around to some of the things that are staff and faculty-facing. There's a survey out there from the American College Health Association that looks specifically at staff and faculty at institutes in higher education and focuses on their well-being, right? So learning more about the American College Health Association and some of the connection Jess has had there, that's been an interesting part of this for me, okay? So what do these pressures affect? And then what are these strategies designed to help remedy? The pressures negatively affect research output, Institute of Higher Education reputation, and then probably the most important one, student success, and they also affect student health. Hello, Anthony. Or, excuse me, employee health, rather. Okay, so in comes the systematic approaches, evidence-based interventions, right? And I got a couple of buckets as far as, as we're working with this wellness commission, like you kind of have some different styles of interventions that you want to use. Information dissemination is one of them, education, pro-health or pro-wellness type activities. And Adams State is actually doing a pretty good job in a few different those areas per some evaluation we did with the CDC Worksite Health Scorecard. All right, but one of the main motivators for this research overall is the rigorous evaluation piece, right? Like, we could get real busy, but would we be able to show that we made a difference? And that's one of my goals of my research. Okay, here's a conceptual framework we started using, right? So this is a community health improvement model. This one comes from an organization called NACHO, and NACHO stands for the National Association of City, County Health Organizations, but basically this should look pretty familiar as far as some type of a framework for doing something, right? It's got 6 different phases here. Over the summer, we started by organizing ourselves, so that means figuring out like who's got vested interest in making a difference in employee wellness, and then creating a vision. We have a really long vision statement that we put together for the President's Commission on Employee Wellness, but I think the short version that works pretty well for it is working at a place where the healthy option's the easy one. Okay. Now, what the hell are you going to do? Well, that's where this assessment piece comes in, right? And they recommend these 4 different assessments, right? And one of them we were very fortunate to already have in place, and that's this community health status assessment, right? So just the other week, we had the annual employee health fair, right? And the annual employee health fair is a service delivered to Adams State employees where folks get the opportunity to come in, get a blood draw, do some biometric screenings, both for their let's see, I guess you'd say their metabolic health, but also for their composition. So we were fortunate to have that. And the survey that I went and did in the spring, I'd say it's a little mix of these, right? And that was one of the challenges because in the context of a workplace health promotion program, there's a variety of different tools out there. There's a variety of different tools that are used in practice. Doesn't seem like there's very many of them that have been validated. And that was a little bit tricky for me because when I had set out in this project, I said, I'm going to find the tools that we're going to use that are legitimate and bona fide. And this is just a new enough thing where it's not out there yet. Okay? So how to think about this thing, right? Looking at 2 categories of stuffs, right? Those stuffs being employee risk factors or individual health risk factors, right? So you have the people here, right? The employee population. What are the things that are impacting their health that are actually measurable and then make a difference in some regards, right? And then my research focused on the preferences for workplace health promotion program activities. My survey went beyond that and gathered some more. We would broaden this category to be, let's see, how would we term it? We would term it as organizational health promotion factors, right? So any of you that participate in that survey, it asked questions about barriers, It asked questions about awareness of resources, a little bit of health culture at work. Okay, so this came from a guidebook from, well, it's out of Johns Hopkins, and I think it's the Institute for Health and Productivity Studies. But anyway, they put together this thing and they said, hey, this is how you should think about this thing, right? You're looking at individual health risk factors and then these organizational health promotion program factors, which also includes leadership. And it's a really handy thing to have leadership support in this type of endeavor. Okay? So the purpose of my research was to assess ASU's employee population's individual health risk factors and preferences for workplace health promotion program activities. My first research question was, what are the most prevalent aggregated health risk factors among the ASU employee population according to retrospective pooled data? And so that's the health fair data that we get that I was, we'll just say, blessed to be able to use and incorporate into my research. And then, what are the ASU employees' preferences for types of workplace-based health promotion program activities? So, what is it that people want to do? And why is this important? This is important because, my citations are foggy, did a pretty big study on workplace health promotion programs. One of the biggest barriers to participation / reasons that people don't participate in workplace health promotion program activities is because they're not interested in what is being offered, right? And as a group, as a wellness commission, we can all scratch our own itches and say, hey, we need to offer this, and we need to offer this, and we need square dancing, and we need kite flying, and we need meditation, and we need these things. But it's not a bad idea to ask people what it is that they are interested in participating in. Okay? So this is my method section. So for the research question 1, we used the ASU annual employee health fair. That was organized by Human Resources. They did all the work. It was super duper for me. And the third party that administers that operation is called Life Health. And they give you a pretty nice, tidy little report after they do that, where they have de-identified and aggregated all of that data. Okay. And the data that's of interest from there, now there's a lot of interesting data in there, but the data that I focused on, we really had to do with the metabolic health panel, in particular the lipids and the glucose, so cholesterol and blood sugar, and then the vital signs, in particular blood pressure and body composition. Okay. So this list right here, as far as like why I chose to focus, is partly responsible on why I chose to focus on those things, right? This is a list of the 10 modifiable health risk factors associated with short-term medical care spending, right? So that's a mouthful, but they're modifiable so you can do something about it, right? Like notice that genetics is not something that's listed here where you need a crystal ball or a new mom and dad and a time machine to fix, right? These are things that you can go and do something about, right? And the research that produced this list took a look at a lot of health insurance claims data, and they said, hey, these conditions, these individual health risk factors, when they're highly prevalent in a group of people, they spend more money on their medical care, right? Because one of the things is, you know, in the service that Adam stayed through this project is to do a nice thing, but also, is there an opportunity to change how we're utilizing our health insurance benefit, right? I know that Shannon went through a pretty big battle recently, fighting out, trying to battle those price increases. The cost of healthcare continues to rise, right? Or continues to rise, okay? And you know, how this comes out as far as like the brass tacks, like, so for example, with like high blood glucose, let's say that I went to this health fair and that I am pre-diabetic, right? According to the literature, someone who is pre-diabetic that doesn't make any lifestyle changes or engage in any medical care, they're about 5-ish years away from moving into full-blown type 2 diabetes, right? And along with the full-blown type 2 diabetes comes thousands, maybe even tens of thousands of dollars on an annual basis in increased medical care costs. So if you can use a little prevention, or early intervention. Maybe you get someone like me who's pre-diabetic to change their lifestyle. I do not progress into type 2 diabetes, and then I save my healthcare plan some money. So what I focused on were these 4 factors right here. We were able to gather information was gathered through the health fair on these other topics, and that included all of them except for high alcohol consumption, right? Got a decent sample out of the health fair, right? Again, thanks President Tamberg. I think our little dealio where we were challenging President Baca over there at the Team Up North State, or the Team Up North College, attributed to us having a bigger sample size compared to the 8 other institutions that participated in it. Maybe it was a high score for us too, but we got a good chunk of folks to participate in that. Okay. Generating data to answer research question number 2, right? Started looking around. I said, man, I'm going to find me a wellness program survey that's got a bunch of literature behind it that's super duper and validated. Turns out there's some behind paywalls with organizations that claim that they can help you reduce your medical care costs and improve employee morale. But you're probably better off building one yourself and using some pretty sound testing it out to the best of your ability, right? And so that was tricky, because when I set out, I said, I'm going to find a tool. It's going to be legitimate, and I don't know that there is one that is out there, because this is a relatively new thing, right? I mean, workplace health promotion been a different thing, but it's been organizationally dependent, right? And it wasn't until 2010 and some of the provisions of the Affordable Care Act that gave organizations some tax breaks and insurance companies some tax breaks by offering wellness programs. And by giving those tax breaks, people were interested in participating in them. And there was a lot of companies that made a lot of really lofty promises as far as this is what we'll be able to do to your healthcare costs, and they really haven't been able to deliver on some of those things. So, started with a survey, was partially inspired by the American College Health Association survey, and then included some stuff from the American, I think I have it listed as a reference. Yeah, the Alliance for a Healthier Generation. These are folks that put together a survey specifically for learning institutions, not necessarily higher education, but for learning institutions. So between those two, I modified their stuff. We did a little audit as a wellness commission to see what is actually plausible for us to offer, and that's how we came up with the 24 items that ended up being on the survey. Okay. Put that into, the selection of the scale. Professor Vernon is here, and he was extremely helpful when it came to figuring this out for me, right? So I got this list of activities, and what I want to know is, are you interested in participating in them? And I wasn't sure how to ask that. I wasn't sure how to put that together in a survey question. I got some encouragement to use a 5-point Likert type scale, but the words of wisdom, I believe, Professor Vernon, were, well, why don't you go into the literature and figure out who else has asked this particular question? And that was useful, and so I listened. And then I found one. A scale of 1 to 4. 1 is no interest, 2, some interest, 3 is interested, and 4 is great interest in participation. So I found a paper from Larson and Kittleson from 2005, and what was tricky about that, and I got more words of wisdom, was they gave you the first point and the last point. They said, all right, 1 is no interest and 4 is a great interest, and it was a mystery as far as the second and third. And continuing on his sagely advice, Vernon said, hey, why don't you give him a call, or why don't you reach out to him? And I didn't know that you could do that. I didn't know that there was real humans that actually write the literature. And sent out an email. I believe you set me up with hey, this is the general whereabouts of these folks. I said, howdy, friends. This is what I'm up to. Can you tell me that second and third point? They said, we'd love to. And you have our blessing to use our scale. So that was fun. So thank you, Professor Vernon, who's been my pseudo methodologist through this process. So plugged it into Qualtrics, did some testing, and then we sent it out to 387 employees, and had a couple prompts over a 4-week period, and got a pretty good sample size out of it. Okay, this is everything that was on the survey. So I added this. I didn't have to present this. study, this is what I focused on for my scholarly deliverables, but here are some of the other areas that we ask questions about. Preferences for times, preferences for communication, right? Turns out people like email, despite reporting that they don't like email, but that was the most popular thing as far as how do you want to receive wellness program information? Turns out that they want it through email, okay? Preferences for, barriers to participation, right? I'm very interested in doing some future research and some analysis in this particular area. Their perceived health, which seems to be gaining some traction when it comes to, when it comes to health and wellness and folks. And then some environmental and cultural factors, right? Like, is this something that your supervisor supports? Do you agree? Do you not agree, right? But I'm saving some of those for later, right? Let's see, this is mostly what I told you there as far as how we got that data. Wasn't a ton of analysis that I could do with the health fair data. It was presented to me as a report. So in the discussion section, I'll talk about what I did to compare Adams State University to national health risk factor data. Okay. This is the rest of those methods. Put it into IBM SPSS, used some descriptive statistics, did some scrubbing. I got 200 responses, which I was very pleased with. There were 172 after I scrubbed the data as far as surveys that were complete in regards to the questions that I was interested in having asked. And I think that comes out to something like a 43% response rate. And so thank you to the Wellness Commission who helped generate that sample. So since I was looking at the preferences for workplace health promotion program activities in that 4-point scale, use some non-parametric testing, use the median to rank those activities with the mean as a secondary way of rank ordering those. Okay. Also created a composite score, right? So that basically said, is this individual who responded to this survey, are they interested in participating in workplace health promotion program activities? Because a decent question to ask yourself before you start a wellness program is, what's the null hypothesis? I mean, you maybe should consider assuming that everybody is already in perfect health and nobody wants to do anything, right? And that's not what our data suggests here. I think it's not the case that everyone's in perfect health, and it is the case that people do want to do some stuff, but now there's some data to back that up. Okay, and then I did a little sub-analysis. The health fair data, the only demographic characteristic that was available for comparing subpopulations was sex. So I did something similar with the comparison of the survey data. The results, okay? So we had that 135 folks participated in the health fair. This is the breakdown by sex. And the thing that's like worth talking about here as far as comparing the samples to the population of employees here is that the fellows are a little underrepresented, okay? And I did do some rank amateur statistical analysis as far as I think chi-square. I think that's what I used. I don't remember, but I didn't really include that into here. It's just mostly a point or a limitation of the of what I was up to. Okay. Health fair stuff. Okay. So with the 4 things that I was interested as far as individual health risk factors, the cholesterol is the one that I choose. Now I chose LDL cholesterol because cholesterol is a mix of measures, right? You have your LDL cholesterol, your HDL cholesterol, and I'm not going to turn into an expert on those things, but this was the one really to focus on here. Body mass index, blood pressure, and then blood sugar, right? And so what's interesting, and mostly what I'm trying to do with this particular graphic is show you, I'm more interested in showing you the green, right? So green represents folks in the normal and optimal range. Everything else is either missing data or these are folks at an at-risk, high-risk, or in an undesirable range. So mostly this is, kind of inverted as far as like Okay, we had the least green here, second least green here, except for there's some of that we don't know because not everybody completed their health screening. And then more green and more green. Now, what's really interesting about this, and something that I would not have anticipated, is looking at this, especially when you start comparing to national data, right? Dyslipidemia and dyslipidemia and hyperglycemia, so high blood sugar and dysregulated cholesterol. It's not uncommon for them to go hand in hand, right? So in looking at this data set, which used fasting glucose, this seemed really, really low, especially when you start comparing it to national averages, because this would be something that if you had a whole lot of faith in it, you'd jump for joy. You'd say, you know what, cholesterol is not going so great, and neither is body mass index, and neither is blood pressure, but man, we are regulating our blood sugar well. Well, there's some limitations to fasting glucose, especially when fasting's an option. Now, they do, in their reports from the health fair, make some age adjustments, and they make some adjustments for whether you fasted or not. But I was extremely pleased, so thank you, Shannon and Tracy, that we added this year the hemoglobin A1C screening. And the difference between fasting glucose and hemoglobin A1C is one is like a right now snapshot, and the hemoglobin A1C is like an average over a 90-day period, right? So when we get that health fair report back, I wouldn't be shocked that this doesn't look that way. In fact, that was my experience over at San Luis Valley Health when I was crunching the numbers in 2017, looking at the biometric data. We were doing fasting glucose as our main way of assessing that particular health risk factor. And then with some partnership with the laboratory, they said, hey, instead of using fasting glucose for about $2 extra, we can do hemoglobin A1C, and it really shifted this distribution in the different risk categories, right? That's my 45-minute timer. Last time I was not a good presenter, and so that gives me about, I don't know, I'm gonna try and scoot. Okay. Now, this is data for research question 2, and these were the top 9 activities, okay, for everybody, right? So up at the tippity top, improving balance, flexibility, muscular endurance, stress management, strength training, and chair massages, okay? Interesting little dispersion here. Now, this is also an outcome that I didn't anticipate happening because what's that? Yeah, absolutely. Yeah, of course, right? What was, yeah. Go. Second floor, Richardson, 12-1. What was interesting for me about this was how mental health or stress management emerged here, right? My experience as a wellness coordinator is the things that people were interested in were diet and exercise. Diet I don't know that it made the top 9, right? So that was interesting, and I think that speaks to some of the changes in stigma around mental health. It probably speaks to a lot of things, but that was interesting for me to see mental health and stress management kind of emerge as top activities as far as what people were interested in. Now, like I said, the only demographic characteristic I had to take a look at with the health fair data was sex, right? So did the same thing with this and broke it apart, okay? So I used a composite score. Chromback Alpha was my tool that I used to verify the reliability in there. And what I found is that the fellows were less interested in participating compared to, males were less interested compared to females when it came to workplace health promotion program activities, and that they had some different preferences overall, but there were 2 that they had in common as far as their top, right? So 2 activities were equally-ish as high rated between males and females. That was the balance, flexibility, and endurance, and stress management. And what this keyed me into was, if we're gonna do something here, if we're gonna create an offering, it probably should include both of these because they're, per this data, similarly attractive to both males and females, right? And using males and females as far as like a subpopulation analysis when it comes to individual health risk factors, like you may or may not be aware, but the life expectancies for fellas is about 6 years-ish less compared to females. So generally speaking, there's a variety of factors here that are interesting, right? Like we have less of a turnout with the male folks here on the Adams State campus. They're pretty close to, like it's really close for you to say that they're in objectively worse health, and they want to do some different stuff. Okay, so compared to national averages, right? And I'll just go ahead and I'll skip this part and I'll use this graphic. It's a little bit difficult to read, but what we have here is green is Adams State, blue is the United States. And as you see here, green is in almost all cases taller than blue, right, across these cholesterol metrics, okay? Over here, this is the body mass index and so body composition. This one's interesting, and I noted the missing data here because what I suspect is that there's probably something meaningful for us here as far as that missing data, right? And then what was really interesting, so back to what I was talking about in the difference between fasting glucose versus the hemoglobin A1C and how that was unexpected, Adams State has like a 33% difference, right? What appears to be favorable in the prediabetes category. Well, and we're going to get some data, and we're going to see maybe we are doing a terrific job of, or maybe all of our blood sugars a-okay, honky-dory. But I agree with you. I think it warrants some further investigation. Okay, and that data was all from the American Heart Association in a real big study where they attempted to get national averages across cardiovascular disease risk factors, which include cholesterol, body composition, blood sugar. Okay. My recommendation, so missing body composition data is a concern. So Darren, maybe you can help me next time when we sit at that table. It could be the thing that where you put a raffle together or something to encourage people to complete those screenings, because I think we're missing a little bit of important data. Yes?
Can we pull in data? Because I didn't do the health screening. I had a physical the same damn day.
Ah.
Right, so all that, if we could pull in data from the physical, this is what they want to show us.
Would love to. Now, when I started this adventure, I really didn't hope to use this data. I wanted to use health insurance claims data, right? That would give us some insight into a whole bunch of health stuff as far as the proportion of our population that was diagnosed with diabetes, the proportion of our population that attended an annual wellness exam. But here's the deal. We're in a group that leverages purchasing power. So we have 8 or 9 institutions that are saying, hey, let's all get together and we'll buy the health insurance together, and that gives us a little bit of purchasing power. But here's the deal. We're not going to disaggregate any of that insurance data. That way there's no like pointing fingers like, Fort Lewis, you sons of guns, you're the unhealthy ones that are screwing us with our premiums, right? So I would have preferred to use that data. And so that's a very good question. Now, like a solution to this potentially is a health risk assessment delivered to our employee population, where whether you got screened at the health fair or you did an annual wellness exam like you did, or you did something at another health fair, that you would be able to input that data, and then we'd be able to do a little bit different, different analysis, right? So sex as a sole demographic limits the capacity to tailor offerings to at-risk subpopulations. I would love if it was possible for that health fair report to be broken down in a variety of different ways. Perhaps employee status, right? Are they staff versus faculty, right? And take a look at, like, maybe we have a really healthy staff, or maybe not so really. There'd be a bunch of ways that I wish that we could break that data down. I don't know if they'll give it to us, but I'm not, having gone through this process, like, I feel a little bit more comfortable about making that ask, potentially saying, hey, health fair folks, Any chance you could turn over that de-identified aggregated data? We'll keep it nice and confidential, but maybe we can do some more analysis, because age is something that is definitely, that's a thing that I really wish that I had some more information about when it comes to the health fair data, okay? Relative to cholesterol, blood glucose was surprisingly low. Okay, so you spotted that, Vernon. You kind of had an aha there. Physical activity is a life. Oh, so here's like the good news, right? For those 10 modifiable health risk factors, in particular dyslipidemia, hypercholesterolemia, and obesity, lifestyle intervention, it's a pretty potent intervention. It's just like, it's a simple solution. It's just really, really complicated to actually get people to do it, right? Perhaps we can leverage this 8-hour window of time, 4 and 5 days a week that we have here, to encourage physical activity, changes in diet, sleep, right? We talked about, there's a little sleep discussion there. I mean, so there's some opportunities there, and that ties into the survey because physical activity is one of those, and that's what people said they wanted to do, okay? Here were the top ranked workplace health promotion program activities, both in a broad category, so that we called these type. The kind would be mental health related or stress management related, and then physical activity, right? And boy, oh boy, I think this really put some wind in the sails. Old Dr. Terry Dupler over there, because we just had ourselves a nice 15-person attended introduction to exercise session, and we had a decent reason to do it because we had some data that said, yeah, people wanted this thing. And I was really pleased with how that went. I'd love to expand it. It's just difficult to scale because of the numbers, but I think there's some creative solutions around it, okay? Physical activities, we talked about that. And that, okay. So I guess if there was an aha or a punchline that I ended up getting out of this, right, is you take the two groups, right, males and females, right, and you look at their preferences for activities. Outdoor activities ranked higher in males compared to females, okay? That's great because it's probably an objectively less healthy population, and I would describe that as a protective factor that we have here in beautiful rural southern Colorado. But then the majority of our employee population, they're female. So are we excluding some people? Why would we offer a thing that doesn't, appeal to most folks, especially if we don't have the data to say, like, this is the population we need to target? Well, turns out that since COVID, some of the outdoor industry reports say that females and children are more interested in participating in outdoor recreation-based type activities. So I think it's a decent enough excuse to say, hey, Will Rickards, we want to go hiking, and it's a decent enough request because there's a group of people that are interested in it. There's a group of people that are becoming more interested in it, and it's right here in our backyard. So don't be surprised if, we see some more, not necessarily like the full-blown hiking, backpacking type activities, but you're probably going to have the Wellness Commission encourage people spending time outdoors. Turns out it's good for you. Okay? So offer the top-ranked activities. If it is the case that the fellows are a subpopulation of interest, consider the outdoor activities, and also consider that those are growing in popularity for the female folks. Okay? And then, which we'll have to get better on, I'm going to be pretty interested in developing some type of a system to track the activity participation when we offer stuff, right? Like, we got a sign-up sheet pulled off for the thing that we did with Dr. Terry Duper, the introduction exercise. It'll be good for us to have a sign-in sheet to see who is participating in these activities. And what I'd also hope is that there's some technology solutions that I'm very interested in looking further into that make this whole process a lot easier. Because one of the gaps that we have here is health behavior information, right? We have some health outcome information as far as the cholesterol and the blood sugar. We have some data on what are people interested in participating in. We don't know. Maybe everybody's hiking 2 miles every morning and eating gluten-free and training for a marathon, like we don't know the health behaviors. And again, a health risk assessment, asking some questions about what your daily activity looks like or your weekly activity, how often are you engaging in vigorous exercise, how much water are you drinking. These will be worthwhile endeavors for the commission. Okay? So limitations, I didn't have a whole lot of control. They just presented that report, and I'm trusting that they're doing the best they can, but I also found typos, and the way that some of that data is presented is a little bit, it's a little bit confusing. Like there's some things that appear to be counted twice, especially blood pressure when it's dealing with two measurements, systolic and diastolic blood pressure, and if you're high in one, that means that you're high, and then so there's like some potential multiple counting. It's not a validated instrument that I used. I feel fancy by using the whole Chromebox Alpha deal, but there's probably going to be multiple renditions of that because, you know, when I first started this, like I would have loved to create the, hey, this is how you should start a wellness program survey, but I got some work to do. And then generalizability. It's probably hard to generalize the results of these surveys or this survey and that health fair to the Adams State employee population because the fellows are underrepresented, and as far as generalizability to the whole wide world, that's not happening either. Okay? So we're using a pretty popular model, right, as far as the Nacho model, which also lines up really nice with some of the folks that are looking at workplace health promotion programs in higher education. We have some outcome measure data, right, that where we can tailor our activity offerings. We have some outcome measure data to see, like, ultimately, did we make a difference, maybe, or is there an association between what we did and changes in health outcomes? And you know, we have a better idea about like what activities to offer, or at least a reason when someone comes up with the grouchy face and says, "Why the hell aren't you offering square dancing?" It didn't make the cut on the survey. We're sorry. So, real quick, thank all of you for attending this. Special thanks to Professor Vernon, who's been extremely helpful with his sagely wisdom and his guidance. Professor Gallardi, who's every time I was down and out going through this project, feeling, right, just frustrated and scared and all the emotions you go through and completing a terminal degree. Professor Gallardi always put wind in my sails. Professor Kyle Glenn always put wind in my sails. Really the whole business faculty. Zena Boozer, my neighbor over in the School of Business, giving me encouraging words. President Tamberg, thank you for giving me the opportunity to study something that I was very, very interested in. Thank you to my students, right? Anytime you guys were grinding out some type of a project and I was feeling sorry for myself, I think about all the horrible, awful, terrible things that you do. And, you know, thank you to my family. Thank you to Adams State. I'm very blessed to have been able to go through this and have all the encouragement and support. Now, how'd I do? Better than the 25 minutes last time. Who's got questions?
I'll have something.
Great. I appreciate that. If you're not careful, it'll turn into a defense with Professor Vernon. Tanberg's?
So what, if you think about the next 1 to 3 months, where do you want the commission to focus? What do you want the commission to focus?
I would like us to go through the prototyping process of offering these workshops or these educational sessions, whatever we want to talk, and start dialing those in from a promotion standpoint, from a tracking standpoint, and use these as baby step kind of experiments. You know, I think our next deal, like Terry's already kind of chomping at the bit to do some more exercise-based stuff. We'd like to see if we can get a similar energy with some stress management stuff, right? And really focus on those. Yes?
I got my hobby boys here.
Okay?
Okay. And AJ knows this.
Yes.
AJ and I, we go for walks and
Mhm.
stuff like that. Now, you guys do. But we have the flexibility to, nobody's coming in the office. That's what, you know,
Sticky note.
Dr. Burton, he called a walk. And, but 63 years old, 6'1", about 40 in there. I ain't getting Fitbit, I ain't getting shit. My family has a history of high blood pressure, and my brother is type 2 diabetic, a really good profile. But our stride reversed it. You know, I put 193 in 39. And then they would hit me up for a digital scale and a larger,
Yeah.
like AI type stuff.
One little fib, you get into a tracking device and a whole nutrition plan.
We could get, the amount of data that we collect with that kind of thing, it might be of value.
Yeah. So what made, like, so as far as like the wearable devices, huge opportunities there, right? And really that's how I ran stuff at the past two institutions where I was a wellness program coordinator. Our workers' compensation insurance paid for it. They said, hey, you can use this platform. It was called Virgin Pulse. If you had a wearable device, Apple Watch, Fitbit, it would integrate into an application that helped you track healthy habits. And if you didn't have one of those devices, they had a proprietary one that used a little watch battery, and it cost. They gave it to you for free because it was focused on the inclusivity. Because there's strong arguments like, wow, you're already fit, Vernon. You're not a health risk. We shouldn't give you anything, because one of the pitfalls of health promotion programs is that it's just the healthy people that do it, right? And so that's an argument to continue to exclude. But I think that there's a really strong argument that, hey, if you're taking walks every day and you're eating your granola and you're doing the things that are, you're cooking at home, healthy meals and stuff like that, there's an opportunity to include you to model a variety of different health behaviors. And you say, hey, AJ, get your, well, yes, right. And so that's another thing that I like to be in. So in the short term, I'd like to pilot these educational sessions, build some momentum, and then start thinking seriously about what are some of the solutions out there as far as a digital platform that integrates with wearables that will give us more health behavior data, and probably also includes a health risk assessment that will give you legitimate recommendations as far as, hey, Webb, you got high cholesterol and your BMI is pretty, your BMI is off the chart. You probably ought to take some walks and eat some vegetables and things like that. And we get a little bit of this. The thing is, it's just kind of all over the place, right? Because the people that would have given you that Fitbit probably has to do with the wellness program benefit associated with Blue Cross Blue Shield or Blue Anthem or whatever the hell it's called, right? Yeah, right? So there's a game, there's a wellness game that can be played with the Blue Cross Blue Shield folks as far as a program that encourages changes in lifestyle behaviors. There's a separate game for our classified employees and folks like me that don't participate in the health insurance. Like, I'm on my own, right? So is there a game that we can include everybody in, which may even extend to spouses, right? That was one of the things I was really proud for and had to really fight for, was saying, one, let's not just make this a insured employee wellness program. Let's make it an everyone wellness program. Now, my non-insured employees over at SLV Health, they didn't get the full monetary incentive that everybody else did, but they got a little something. And there was an opportunity for everyone to send an invite to include your spouses to play the Virgin Pulse game that we were using, right? Because, at least it's my experience, right? Like, you get that extra support at home to reinforce what you've been working on at work, and that's desirable. So, back to your question, pilot some of those things and really start thinking about spending this next summer in a little bit more rigorous, and maybe getting some sagely advice from Professor Garza as far as creating a strategic plan for wellness programming. Also, with the new strat plan out, I love to I'll be contacting Carol, because I'd like to know which pillar does this type of initiative best fit for Adams State. And what I would also love for that to be is, like, is there someone with consequential deliverables where this is really obvious that it supports, so we can fan the flame and help them achieve their goals by getting people out, walking, being nice to themselves, eating salads, drinking waters, right? And so figuring out where we fit as far as the strategic plan goes, and building that relationship with whoever is in charge of that, and look into the summer to say, hey, let's set a goal, right? And it may just be process-based as far as number of enrolled folks, number of engaged folks. I don't know exactly what that'll look like, and it'll be for the group to come together and decide it. I have some really strong ideas, but I'm also not particularly interested in dominating that conversation because I am the one who has the experience in a wellness program. We got to make our goal, and we got to work together, work towards it together. Does that answer your question? Other questions? Mondragon? Martinez, you got anything? Sir? No? Thank you all so much for your time. I really appreciate you all walking past Candy to come hang out with me. All right? And hope you have a good rest of your evening. Thank you very much for attending.
Good job.
Thank you. Jared, my man, you're always there for us. I appreciate all the support you give us.